Social care affects over 10 million people in England. In its most basic form, it is the non-health care that people of all ages need if they require extra practical support in their daily living due to an illness, disability, or age. This covers both physical and mental conditions. But due to eye-watering bills, a declining workforce, and an ageing population, social care in England is now at breaking point.
We should be focusing on giving the support people need to live the lives they choose. And where we are now is very far away from that. People don't want to think about it. People don't plan for needing care. They don't put money aside for it as they do other aspects of their lives, because nobody, it seems, wants to think about when they're so old that they're going to need that daily help. The other side of things is that most of the public, most members of the public, don't understand that it has to be paid for. So I know when constituents come to me, it's shocking to them that it's not free. That if they are a family member, need care, if a family member, say for instance, has dementia and gets to the point of needing care, they suddenly discover that they need care, and that's very expensive, and it's not something that's going to be provided for them by the NHS.
In his first speech outside Downing Street as Prime Minister, Boris Johnson made social care a priority for his new government.
We will fix the crisis in social care once and for all with a clear plan we have prepared.
2 years on, the clear plan promise had yet to materialise, but with the NHS badly hit by COVID, the government has tried to tackle the problems in both the health and care systems with a combined £36 billion investment. This will affect social care in two key areas.
The first change is that the means test, and at the moment, as you know, social care isn't like the NHS, it's not free at point of use, it's means tested. So the money will help make the means test a bit more generous, essentially. So starting in a couple of years' time, if you or I approach our local authority and ask for support, we're more likely to get in and receive support than we are at the moment. And we think that's a very positive thing that needed to happen. But the second thing is that even if we still have to contribute towards our care or pay some or all of our care, the government is saying that there will be a cap on the amount that we might pay over a lifetime. So it's saying, and that cap will be at £86,000. And again, we think that's a really positive thing to do.
There are serious question marks over whether this new investment is the silver bullet for social care. If you break down the £36 billion the government hopes to raise in the next 3 years, most of the funds will go towards the NHS, with around £9 billion alone being put towards clearing the covid-inflicted NHS backlog. This leaves only £5.4 billion earmarked for social care. £500 million of that last sum has already been set aside for training up a depleted workforce with an alarming 30% turnover rate. Beyond the 3-year plan, there is no guarantee as to how much will be spent on social care in the future.
We think overall the money represents a significant step forward for adult social care. But what it isn't is the giant stride that was really implicit when the Prime Minister talked about fixing adult social care once and for all. To do that, we'll need a lot more thought, a lot more investment, and we recognise that that will take time to happen. But we think it's important that people get behind the measures that are there at the moment and get those over the line, because there's a history in adult social care of reforms being proposed, actually making it somewhere, including to sort of getting enacted, but then never being implemented. So let's not let that happen to this package of reforms.
How is this all going to be paid for? The government has announced a new health and social care levy, primarily funded by an increase in national insurance contributions, also known as NIC. Listening to both political leaders talking about it, you'd have thought they'd got their scripts mixed up.
The Conservative government, Mr. Speaker, ever wants to raise taxes, and I will be honest with the House, I accept that this breaks a manifesto commitment, which is not something I do lightly, but a global pandemic was in no one's manifesto, Mr. Speaker.
Read my lips. The Tories can never again claim to be the party of low tax.
Why has the new levy caused such political controversy? Well, it's about who the tax hike hits the hardest. For employees, NIC works like this. You pay 12% of your annual earnings up to the threshold of £50,268. Any earnings above that sum fall under a higher rate of 2%. This means that if you earn below £50,000, you're on average paying a higher percentage of your annual income towards NIC than if you earn above £50,000. Put simply, people with less means to cope with the tax increase are now being asked to shoulder a heavier burden.
Putting taxes up higher when we've already got a 70-year high tax burden isn't the answer. It's going to be hitting the young, the poorest in society, the hardest, and as you mentioned, young people are renting. They're the people that are going to be paying, so that then quite often sometimes wealthier people that have been able to purchase their own house are then going to be able to have social care at the same time. And when we actually look at those who are the least well off in society, the poorest 10%, they're already, before this tax rise, losing 57% of their income in taxes. And so hiking national insurance is only going to be making their lives more difficult.
Social care has been a tough nut to crack for past governments. The new funds for social care will improve the situation for many people across the country, but doubts remain over the long-term prospects for social care in England.
I think it's a question of having a vision of what you want social care to do, and it's not difficult, because if you ask people who rely on social care, they tell you what they want. I mean, you know, whether it's a working age disabled adult or an older person, if they need help, you know, with the start or the end of the day, they don't say, for instance, want somebody to turn up at 5 o'clock to get them ready for bed at 5 o'clock. That's not the life that people would choose for themselves, is it? You know, that if you're isolated and you know, needing some support, you don't want a sort of 12 to 15-minute visit where somebody rushes in, you know, does a few tasks and then rushes off again. So, you know, people that need support to live their daily lives, they want a kind of human relationship with the people that are providing that support, and that's not a lot to ask for.